We are talking about, there's news of protests, there's news of moments of grace and kindness that people are witnessing too. But this is a very scary time for children who might be seeing news reports. What are some ways we can help them work through their anxiety, but also address the very real and serious issues that are going on right now?
Right. So over the last few months with the start of COVID and now with the events that have unraveled over the last week or so, our kids have been under a tremendous amount of stress. And so I want to take a step back for a minute and talk about toxic stress in children, or what some people may have heard of as termed adverse childhood experiences. So there was a study that came out of Kaiser back in the 90s that looked at adults who had undergone some sort of chronic stress. And sorry, I think there's a delay. So there was a study that looked at adults who had chronic medical conditions, diabetes, heart disease, and they looked at questions. There were 10 original questions that looked at whether or not they had been recipients of physical abuse, not recipients, but if they had been involved with child abuse, if they had been neglected, if they had had an incarceration or separation in their family. There were 10 original questions that they looked at. And they found in the study that the more adverse events that children were exposed to, the more likely they were to have chronic diseases of adulthood. And again, that includes diabetes, asthma, heart disease. And so, we know that stress is a part of childhood, it's a part of adulthood, but usually the stress is buffered by something positive. So our kids may feel stressed on the first day of school. They may feel stressed when they have a test coming up, but it's someone who loves them and cares for them in their environment that says, it's going to be okay, I'll be here for you. And so, we do have moments of stress. And again, those are buffered, or we are protected from ongoing stress. So when kids are exposed to ongoing images of violence, of fear, they're living with a higher level of stress hormone just constantly going. Now, those 10 original questions did not look at racism or discrimination or repeated media images of violence. But we know now that things such as racism, things such as discrimination, homelessness, those are toxic effects. Those are negative experiences for children. When they live with them at a constant level or constant exposure, they are just living under constant stress, and they lose the ability to really cope. So our job, me as a pediatrician, my colleagues here in the hospital, anyone who takes care of children, anyone who's dedicated to children, teachers, our bus drivers, our cafeteria workers, daycare providers, it is our number one goal to ensure that we lift children up and that we provide them with the best experience, the best possible potential outcome. We want them to be their best. And so it is really inherent upon us to make sure we are protecting them and to make sure that we are being honest with them and talking openly that all children, that all individuals, regardless of race, regardless of background, do not deserve that type of treatment. And so it's really just inherent upon us to make sure we protect our kids.
And is a child ever too young to have a discussion with them about issues like race and discrimination? Because the collective sentiment right now seems to be, we need to start talking about this. But is there an age when it's just simply too young to be going there?
Well, I think it's like anything that we talk with our kids about when they ask about where do babies come from. It's a much different conversation when the child is 3 than when the child is 15. So as long as it is age appropriate, and we want it to be balanced. So we don't want to demonstrate to our children that same anger, fear, violence. We want to really model for them what we want to see. And again, just age appropriate.
Okay, thank you, Dr. Sosa. The original intent, of course, for this virtual health series was to talk about balancing the need to keep your kids safe at home and to also make sure they're getting the proper routine checkups that they so desperately need. So one of the top questions, which people can still submit on Facebook and on Instagram and on Twitter, one of the top questions we've gotten from parents is, during this COVID-19 outbreak, is it safe to continue to visit your pediatrician for things like wellness routine visits and for vaccinations?
Right. So at the first, when things first happened, it rolled out in the middle of March, you were probably finding that a lot of offices were canceling or holding on visits. And now, we are really trying to get kids caught up, those who were, whose appointments may have been delayed. It is safe to go to your doctor's office, your pediatrician's office, to hospital, so long as those places are practicing guidelines that are put forth by the AAP, which is the American Academy of Pediatrics, and the Centers for Disease Control, which is also known as the CDC. So some of those guidelines that have been put in place include screening employees to make sure employees have not had an exposure, screening for symptoms of COVID, such as taking their temperature every day. I know that happens to me every day when I walk through the door. I get the same question. And throughout the day, if someone is not feeling well, if they develop symptoms throughout the day, we immediately send them home. So some of the other suggestions or recommendations for outpatient practices have included scheduling well visits during, say, one part of the day and sick visits during another part of the day, making sure we are frequently cleaning surfaces, using proper hand hygiene, making sure that we are using gloves and masks when we are interacting with individuals, patients. And if there's a suspected case of COVID, some of the other things that we're doing to keep you safe are that we are, again, screening in advance so that if someone does have symptoms, we can either bring them through a separate entrance, use a separate room for isolation. We just take extra precautions. So yes, it is definitely safe so long as your offices are following the guidelines.
So what should parents do prior to coming in for a visit if they do have one scheduled?
Yep. So I think it's very important if you are nervous at all to call the office and to find out what exactly are those procedures that they have in place. What types of things are they doing to help ensure my safety and safety of my child? And we're also looking to ensure our own safety to make sure that we are here to continue to take care of your children. So call ahead to talk to your doctor. You can talk to your children about what they may expect. So we are going to be wearing face masks. We're going to be wearing gloves. I'm not wearing a face mask now because I'm sitting in a private office, but as soon as I step out that door and anywhere I go on campus, I have a face mask on. But talk to your kids about what that might look like. Show them pictures of doctors who are wearing face masks. You can have them play with a face covering on maybe their favorite stuffed animal, and just talk to them again in an age-appropriate way about what things they might see. And if they feel scared, it's okay, and that you'll be there to help them feel okay and be okay.
So Valley Children's does have a network of primary care practices, Bakersfield, Merced, the Fresno, Clovis area. Ours are all open, and we work with so many pediatricians and family practitioners throughout our communities. And something that we're hearing from some of the pediatricians who we also have partnerships with is they're getting a lot of parents who are saying, can't I just postpone my vaccinations till after all this COVID stuff is over? Is it a good idea to mess with the vaccination schedule, or is it really important to stay as on track as possible?
Right, so the American Academy of Pediatrics definitely recommends we stay on track with vaccines. And just to put it in a pediatrician's perspective, some of you may remember, I know I remember, being taken to a chickenpox party. So parents may remember and grandparents may remember. The chickenpox party was an attempt to expose you to chickenpox when you were really young, because we know that there are much fewer complications when you're young than when you're an adult. And since that time, we no longer have chickenpox parties. And that's because about 26 years ago or so, in the US, the chickenpox vaccine came out, and we've had such a tremendous decrease in chickenpox cases that I can tell you I have probably seen one in the last 20 years. I know that the residents that I work with, those are doctors who are in training, most of them have never seen a case of chickenpox. And then also, when I was training, during that time period, there were some vaccines in development that fought against meningitis in children and severe gastrointestinal vomiting, diarrhea diseases. And what I used to see as routine hospital admissions, meningitis in babies on a weekly basis, babies admitted for severe dehydration within 6 to 12 hours of them getting sick. Since those vaccines have come out, those numbers have dropped dramatically. So yes, we're seeing fewer cases, but there are still diseases out there, which is why you may see that there's a measles outbreak from time to time. Those usually occur in unimmunized individuals. And so, yes, it's very important to stay on schedule with vaccines because it helps to prevent and protect your child from those vaccine preventable illnesses that we've seen such a tremendous decline in over the last few decades.
What about for parents whose children need to come in for a wellness visit? It's like their annual exam, but they're not scheduled for any vaccines during that visit. Is that one of those that you should still do? Can you delay it? Or should you still also attend those appointments?
Sure. So the American Academy of Pediatrics originally recommended back in mid-March that only those youngest children who still needed to stay on track with their routine childhood immunizations, that they come in, and they have since expanded that mid-April, they expanded that to 2 years, and now they continue to expand that children come and have in-person well child visits whenever possible. Because not only are we providing vaccines, but for younger children, we're monitoring their development. We're making sure they're gaining weight properly. For our early school age children, we may be looking for signs of a learning disability or a difficulty. And for our kids, especially as they get to be 7, 8, 9, and then into the teens, we talk to them a lot about stress, about their emotional well-being. And so, especially in this time that so much is going on, it's really important for us to be able to check in with them and make sure not only is the patient okay, but that the family is okay.
That leads to the next question. One parent asked, could my child catch the coronavirus or COVID-19 at the doctor's office?
Well, it's certainly possible that your child could catch it at the doctor's office. Again, your doctor's offices and hospitals are taking many, many precautions, including separating visits or lengthening visits so there are fewer people in the waiting room at one time, doing things to decrease the amount of time that you may be in the office. So if there's paperwork that needs to be completed ahead of time, they may have you do that, or paperwork that may normally be done in the office, they may have you do that ahead of time, again, to reduce the amount of time that you're physically in the office. So while it is possible, it is much more likely that your child or you would contract coronavirus from being out and about at a major store, at a supermarket, where many others are not taking precautions and wearing the masks and social distancing.
Okay, and we get this question all the time during cold and flu season, and now we're adding the layer of COVID-19. How can parents tell the difference if their child has cold, allergies, flu, COVID-19?
Right, and a lot of times it's really difficult. So we have some really good data coming out of China that looked at it was over 2,100 kids. And we know from that data that the vast majority of those kids had mild to moderate symptoms or even no symptoms at all. So they don't seem to get the severe respiratory illnesses quite as often as adults do that we're hearing. So your child may have some of the same symptoms as flu, would be a fever, it could be some cough, runny nose, sore throat, some body aches. But we would still ask that you treat them the same at home, make sure that they are getting rest, make sure they are taking plenty of fluids, and only bring them into the office if it looks like they may need some more significant medical attention. So looking at that data from China, not to say that children don't get more severe disease, they can, and so it's really important that you watch for symptoms that they may be getting worse. I'll also add that what we are learning about coronavirus is that many kids have just gastrointestinal disease. So what that means is they may have some nausea, vomiting, or stomach pain. And so in those instances, the same thing, we want to ensure they're not getting dehydrated, that they're just taking in enough fluids. And so your kids may not have the severe respiratory symptoms again, like we do see in adults. So to kind of sum that all up, you may not know, but with all of them, with all viral illnesses, the main point and the main treatment is what we call supportive care. So making sure they are hydrated, making sure they are comfortable, making sure they are resting, and letting the virus take its course.
And there are some parents who might be hesitant, who might be a little hesitant to call and because they feel they might be bothering their pediatrician. But you've said before to many of your own families, please, if you have any question, call. It's okay, right? We want to empower the parents to ask you questions.
Right. I mean, that's our whole job. We are really dedicated to taking care of kids. It's never a bother. There's never a wrong question. There's never a bad question. We as pediatricians, I think we see all of our patients as our own children. And I just really encourage parents to call and to ask questions. It's not a bother.
Someone asked, cities are slowly opening up. Some cities are already in phase 3 or getting very close to it in reopening. And so some parents want to know, how can I keep my children safe when they do return to daycare and then hopefully later this summer, fall to school?
Right. So the schools and daycares are working closely with the local public health departments, regardless of where you're living, following CDC guidelines that have also been put out for educational facilities and for daycare centers. Some facilities have stayed open, daycare facilities, but most have closed. So for those that have closed, because the question was about getting back into daycare or school, schools and daycares right now are in a planning phase. So they are working on how they will reintroduce kids into the educational system or into the daycare system. They are also encouraged to come up with a plan for when there is an identified case or when there is a symptomatic child. So your school or daycare may be working with you in advance of going back on that plan to get your child out of school or daycare as soon as there might be symptoms of illness or of contact. But things that you can do in the meantime is to continue to practice social distancing, excellent hand hygiene, and for children 2 and over, wear a face covering. Just talking really quickly about face coverings, there are guidelines on who should be wearing face coverings. So those would be individuals who should not wear face coverings are those who are children under the age of 2, anybody who's having severe difficulty breathing, and then anyone who is incapacitated to the point where they could not remove their own face mask, and that is because there's a risk of suffocation.
Okay, there is one question here from a parent who says, I understand that my child with Down syndrome is not immunocompromised. However, his immune system disturbances make him more susceptible to infections. How can I keep my son safe?
Right, that's definitely really scary. I'm a complex care pediatrician, and so that is the concern of a lot of my patients' families because they may have other underlying illnesses. So again, it's a lot of the same is going to be social distancing, wearing face covers when appropriate, avoiding large crowds. So keep your kids indoors if you can at home. And this includes, even not playing with kids in the neighborhood because you don't know, while you may be practicing all of those things, you don't know if your family's down the street or across in the house next door. You don't know what they're practicing. And so it's just really important to maximize everything possible to keep your child from being exposed.
For those of you just joining us here on Facebook Live, this is part of our virtual health series for families. The topic today is vaccinations and checkups during this COVID-19 era, joined by the medical director of our Valley Children's Primary Care Group, Dr. Carmela Sosa. She is also a complex care pediatrician. Speaking of complex care, Dr. Sosa, I know you touched on it just now, but there's a broader question. Someone asks, children and youth with special needs may be at increased risk of complications from COVID-19. What information and tips could you provide to my family whose children have routine appointments and therapies and supports as part of their daily routine?
Right. So we are, I will just say anecdotally, this is not out in the literature yet, but among physician groups who take care of medically complex children across the country, what we're seeing is that the disease burden to date has been much lower in kids who have medical complexities. And that's because the parents have been so extremely cautious in social distancing, avoiding crowds, using their own face covering to avoid exposure, frequent cleaning of surfaces. So that in and of itself seems to have done a tremendous job in keeping those kids safe. Again, that's just anecdotally. I would say we were seeing that in our own practice as well. So I will say, as the schools are opening up, we are currently in discussion with local schools and again, with physicians across the country who are taking care of similar populations of medically complex children. And we're looking at partnering on how we may phase in with the schools' education and how we will be able to accommodate and make sure we are as safe as possible in terms of caring for your kids, especially those who need any sort of aerosol generating procedure. So aerosol generating procedures, which you may have heard of, would be coughing, suctioning. Anyone whose child has asthma may have used an albuterol treatment or like a machine to help with asthma. So those are procedures that would put someone at higher risk for spreading coronavirus. And so again, we're working with schools, with public health departments, CDC, following all those guidelines to ensure we are taking all the steps necessary as we are working on phasing in education.
So one parent says, thank you for helping me adjust my child to a future doctor's appointment. But then she asks, the thought of bringing my children to the doctor's office is now giving me anxiety. So what do you want to tell to this worried mom who's like, okay, I know how to prep my kids, but I don't know if in my own headspace, I am ready to do that.
Right. So along the same lines, talk to your doctor's office, find out what it is that they are doing. We know in terms of masks that that covering really helps the wearer not spread nearly as much to others. So anyone that you're coming into contact with, you want to make sure that, number one, you're staying at least at 6 feet apart, but that they are wearing a face covering. So talk to your doctor's office to make sure that everyone there is going to be wearing face coverings, that they are screening people when they come through the door, that they are limiting the numbers of people who can come with the child. Again, that just limits your exposure. Talk to them about frequent cleaning of surfaces. Is the exam room that I'm going into, will that be a well child only exam room versus a sick or well? So keeping the populations of sick children and well children separated, not just in space, but in time, morning versus afternoon. And anything that you can do personally to minimize your physical time in the office, ask about what you can do there to help out.
That brings me to another issue that we hear a lot about. There are people who are complaining and saying, I don't want to wear a mask. It's not going to protect me from getting COVID-19 from someone else. But that's really only part of why everybody should be wearing masks. Do you want to explain, again, just for some people who are on the fence or don't feel it does any good, why it is so important for you as an individual to keep your, and we always see people wearing it down here, to keep your nose and your mouth covered?
Right. So the coronavirus is spread by respiratory droplets. So that means anything that comes out through speaking, coughing, sneezing. And so again, like you said, it's important to keep your nose and your mouth covered and to not pull that mask down to talk. You can pull it down briefly if you need to eat or drink something. But you want to make sure that if you are touching your mask, you're performing hand hygiene, number one, before you touch your mask in case you have coronavirus in your hands. And touch your mask if you need to move it. And then after that, you want to do hand hygiene again, because you don't know if potentially you were exposed to someone and now there's coronavirus on your mask. So number one, doing that proper hand hygiene before touching your mask, or try to avoid touching your mask if at all possible. So what we know about coronavirus is that it can be easily up to 14 days before symptoms appear. So you, although you feel well, you may not know that you've been exposed. You may not know that you're infectious. And you may be spreading it unknowingly. So it's really out of caring for others and sort of that initial respect for one another and human beings that we want to do that and wear that mask. Because you don't know that perhaps the person, if I'm not wearing a mask, perhaps the person that I'm speaking to, maybe they have an elderly parent at home, maybe they have a child who is on chemotherapy at home, and I would be unwittingly spreading it potentially to them, to their child. So it's not just about keeping me safe, it's about us working together as humankind, really, to protect one another.
Thank you for explaining that and sharing the importance of it. Someone asks, what is the best way to find a new pediatrician?
Oh, Well, I think oops, you know what? My office lights are on. There we go. They automatically turn off if there's not a lot of motion. So one of the best ways is with the internet that we have now is to look online. You can, but you can look around to see who's close to you geographically. You can talk to your insurance company to see who they are contracted with. But I think one of the best things to do is to make an appointment with a potential pediatrician and sit down and talk to them and make sure that, you know, that you jive, that your kids like them, that you like them, that you feel comfortable. You want your pediatrician to be somebody that you, as Zara had mentioned earlier, I feel like I'm bugging my pediatrician. You want to have a relationship with your doctor where you feel you can ask them anything and they will be respectful of that. So you can look at licensing, you can look at training, but I think a lot of it comes down to that relationship that you will have. I will add for family practice, for pediatricians, for all medical specialties, there are certifications that we get. So board certification is an important factor in choosing any physician, including a pediatrician. And you can find whether or not your provider is board certified online. And what that means is that we undergo annual requirements for continuing education. We take exams and we have to do quality improvement projects. So every couple of years, we have to go through what some of our processes and procedures are and look at where our gaps are and make sure we continue to improve our care.
Thank you so much, Dr. Sosa. To recap today's virtual health series, I think what I'm taking is the main messages are: wear a mask, practice social distancing. It is safe to go see your primary care provider for vaccinations and wellness visits, and just be kind to one another. Did I sum it up?
I think so, yeah.
All right, Dr. Sosa, thank you so much for your time today, and thank you for answering our families' questions that they've been posting online. I appreciate your time.
My pleasure, thanks.
And for those of you at home, anytime you have any information, just go to our website, valleychildrens.org, and you can also go to a special site we have that lists all the resources and information you might need to know about COVID-19. That's valleychildrens.org/COVID-19. Thank you so much.